This video will discuss about personal protecting equipments PPE. What is PPE? It is a specialized equipment which used to protect ourselves and the patient from germs. It protected healthcare worker as well as patient from microbes. This one create a barrier between germs and you. So, what are the purpose? To stop the spread of infection. Why we want to use PPE? What is the purpose? To stop the spread of infection, to protect ourselves from germs. It give protection to us. Protected client their family health. After that, protect the community health. First main purpose, stop the spread of infection, then protect ourselves from germs, then protect client their family health, then protect community health. What are the key principles for usage of personal protective equipment? We must change gloves or apron between patient. Then you must decontaminate your hands between patient. Then remember to avoid touching our mouth, nose and eyes. Then COVID-19 spread predominant by respiratory tablet, so we can use surgical mask. So here what is the principal use? We must change gloves or apron between patient, then decontaminate our hand between patient, then avoid touching mouth, nose and ears. COVID-19 predominantly spread by droplet, so we can use surgical mask for routine care. These are the key principles for usage of personal protective equipment. Next, what are the articles we can use? First one is Google. These goggles protect the mucous membrane of that eyes when during situation where blood, body fluid secretion or excretion. So, Google protect the mucous membrane of the eyes from blood, body fluid secretion or excretion. Second article is uh, mask. Mask main role to protect from droplet transmitted disease, that mycobacterium tuberculosis, COVID-19, like that droplet through airborne transmitted disease production purpose we can use. Then apron provide an additional layer of protection to the front of that body against the exposure to body fluids from the patient. So this apron provided additional layer of protection to the front of the body against the exposure to body fluid from the patient. Next, protective equipment, gloves to used to protect hand from germs. They provide proper protection from infectious disease, so it protected hands from germs. They help protect directly handling potentially infectious material or contaminated surface. So it protected our body from contaminated surface as well as infectious material. Then gown helped protect you from the contamination of clothing with the potentially infectious material. So this one product contamination of clothing with potentially infectious material. Next one is face shield. This one help to protect our face, nose, mouth, eyes. So this face shield help to protect our face, nose, mouth, and eyes from infectious disease. Next article is head cover to minimize the risk of falling hair into sterile area. So minimize the risk of falling hair into sterile area. Then shoe covers provided a barrier against the possible exposure within a contaminated environment. So provided a barrier against the possible exposure within the contaminated environment. Next procedure, how to wear. First one is gown fully cover from neck to knee. So this one gown we this gown when we are wearing the time fully covered from neck to knees, arm to end of that wrist, and wrap around at the back. Second one is mask. It provided securities. So fit flexible band to bridge. Then fit the face and below chin. Then fit check respirator. Then googles are face shield. Place over face and eyes. Adjust to fix. Then gloves extend to cover wrist of isolation gown. Then how to remove all the diagram attached. First gloves, outside of the gloves are contaminated, all the things outside, all the article outside contaminated. So we can follow hand hygiene with both hand cloud grabs the outside of one gloves at the top of our wrist, being careful not touch you bare skin. At that time we never touch to our skin. Put off these first gloves, peeling away from your body and from wrist to fingertips, turning the gloves inside out. Then hold the glove you just remove in your cloud hand. Then with your unclouded hand, peel off the second glove by inserting your fingers inside the glove at the top of our wrist. Then turn the second glove inside out while tilting it away from our body, leaving the first glove inside the second. Then dispose the gloves safely. Don't reuse the gloves. Clean our hand immediately after removing gloves and before touching any object or surface. How to remove Google or face shield. Outside of gloves or face shield or Google are contaminated. So your hand get contaminated during Google or face shield, removed immediately. Wash your hands or use an alcohol based hand sanitizer. Then remove Google or face shield from that back by lifting hand band or earpiece. If the linen item are reusable, okay, reusable means we can do reprocessing, otherwise we will do discarding in a waste container. In this one, any linen material is reusable means we will put in reprocessing process, otherwise we put in that waste container. Then gown front and sleeve are contaminated. Unto ties and full gown away from body. Carefully roll gown inside out. Dispose into waste container. Perform hand hygiene. Then mask or respirator. Grabs the ties from the top of the head and gently pull off the face mask. Don't touch the front of the mask. If the mask has earlobe, lean forward and grabs the loop from each earlobe. Take off and discard. Perform hand hygiene between the step. If hand become contaminated and immediately after removing all personal protective equipment. Last conclusion, personal protective equipment user against health and safety risk at work. It include items such as head capes, gloves, Google, apron, shoes, and mask. There are the physical barrier that prevent healthcare staff from being contaminated with blood and other body fluids. Thanks for watching.